A whistleblower in Tasmania's Child and Adolescent Mental Health Service has warned children are dying because of a lack of resources in the system. The allegation comes as a mother who lost her son to suicide last year says he experienced a revolving door of locum clinicians who gave conflicting and unhelpful advice. Workers are now considering industrial action, calling for more permanent staff in regional Tasmania.
Alina Tyler takes comfort from looking at photos of her son Braden in happier times. Braden took his own life last year. His mother says he died needlessly, failed by a mental health system in crisis.
He's got to the stage where he didn't trust the doctors. He told the doctors on several occasions that his medication wasn't helping him. It was doing his head in, but they didn't listen to him. They wouldn't listen to us when we were trying to explain that things weren't right.
Over 4 years, Braden was assigned to 7 different fly-in, fly-out psychiatrists.
They never read the notes, they never went through. They went through. We had to tell our story every single time that we went there.
There was so much in the way of changeover of doctors. Polypharmacy was involved. Switching medications from, well, 1 week to the next, virtually.
Workers in Tasmania's Child and Adolescent Mental Health Service believe stories like Braden's are avoidable.
People are dying, yeah, and it's something that workers have to deal with as well as families have to deal with, and it wrecks communities.
Tasmania doesn't have a dedicated psychiatric ward for mentally ill young people. Services for adults are under immense pressure, with patients sleeping on the floor of the Royal Hobart Hospital last week. If things don't change, will children die?
Children will keep dying, and very highly qualified professionals will get burnt out and not work.
The Health Minister, Michael Ferguson, says the government will open specialist mental health facilities for young people, investing $95 million over 6 years. Miss Tyler says help is needed now.
It's been a nightmare. It's been hard. I've had a breakdown. There was just no support.
When children go to hospital with self-inflicted injuries, they're often sent home the same day.
You don't want a 14-year-old girl, in an adult ward. So they just said, oh, your parents will have to look after you.
Several families who've dealt with the system are now calling for a statewide investigation into youth mental health services. Workers are considering industrial action, demanding an increase in permanent staff. Henry Zwartz, ABC News.